I'm Dr. Gordon Sasaki. I'd like to tell you a little bit about my background and why it's important for me to speak to you this morning about this amazing product. I'm a plastic surgeon and director of the Sasaki Advanced Aesthetic Medical Center. It's a university-affiliated private practice in Pasadena. As a clinical professor and a president-elect for the Aesthetic Stem Cell Society, my basic and clinical research in regenerative medicine for over the past 20 years has allowed me to focus on the safety and effectiveness of adipose stem cells, platelets, secretomes for skin grafting, skin rejuvenation, for fat grafting, and for hair growth. So this particular product line just fits in very well to my practice, as I am very active in the area of hair rejuvenation. The question that is frequently asked for me is that how did I become acquainted with the Revivv product? I want you to know that I am an advisor of the primary company, which is We Thrive, and was fortunate to be one of the first clinicians in the United States to introduce this novel serum to patients in my practice with androgenetic alopecia. The historical use of minoxidil and finasteride, as I'm sure you're well aware of, these are monotherapies, which means that we use them only in isolation, but can't combine them with other types of techniques, such as platelets or secretomes. And this particular two drugs have been approved by the FDA for about 2 decades. And it does provide growth. It does provide growth primarily to the crown vertex area, which is in back here, but less to the frontal and the temporal scalp. And this has historically always been true with any type of topical treatments that have been given or any of the oral treatments, other than hair transplantation. Despite successes with these particular drugs, they do have certain drawbacks in the sense that there can be significant types of side effects. For example, in the use of finasteride, it can produce degrees of sexual dysfunction and depression, such as the FDA requires the addition of an adverse list on the finasteride label, although there has not yet been found any direct linkage with the usage of finasteride and depression. Therefore, part of the conversation with the use of either minoxidil or finasteride should include the topic of compliance, because as most regrowth hairs occurs in these particular areas, they will be lost if one stops the drug within about 6 months. So it becomes a problem of how long does the patient use it and what do their expectations are, and if they ever stop it, then whatever they have gained will probably be lost. Now, why do I recommend this particular device and its ingredients to my patients? I understand the pharmacological aspects of these particular elements because of my research in this area for many years. But it contains a plethora of blended, what we call bioactive natural photochemicals. In other words, they're from plant-derived. And they're designed to stimulate hair growth, they reduce shedding, and rehabilitate the hair follicle homeostasis.